public services in Alberta are under attack, and we are very concerned about that. Right now, the front page of the newspaper yesterday was talking about the cuts to education, that there's going to be a great number of teachers that are going to be laid off this year, and students are going to suffer.
We launched today a major coalition and advocacy efforts to mobilize people across this province to take action, to speak out for quality public services, the things that matter, the things that make the vibrancy of their community work. So we're here talking about education, post-secondary education, disability services, and to basically say that Alberta can afford to build quality public services and that we need to change the direction this government is going.
Well, I believe that education and healthcare are the two tenets of any successful society. You can't have one without the other. And so as a nurse and a parent, and nurses are parents and they have children and they work with children, we all see what education does.
The government announces $550 million to build and renovate schools this week. Well, at the same time, we're facing $100 million in shortfall in programming for students that are already in our schools.
Our provincial government wants Albertans to believe that these are tough times. They want us to believe that the recession has left them with no choice but to trim budgets and cut funding, even for vital services like education. People like Premier Stalmach and Education Minister Dave Hancock put on their most sorrowful faces. And they say things like, "We're sorry, but really, we have no alternative." But ordinary Albertans know in their hearts and in their guts that there's something seriously wrong with this picture.
All of these public services are absolutely connected. Healthcare funding was I guess a little luckier than education in that we've been told that we have some stable, predictable funding for the next couple years, but it's still not quite where it should be, and the cuts to education are severe, and the education needs stable, predictable funding the same way that healthcare does. Nurses are still worried about this. They realize education is absolutely essential. And it's, as we heard here this morning, a good education is an important social determinant of health.
Our community town halls are going to take place through the month of June. We're going to be going to 7 cities across Alberta. All of these events will take place at 7 o'clock. All of these events are free, and what we really want is to get people out to not only hear about these messages, but again, to take away the advocacy toolkits, to get involved as citizens, and to also share their stories about how these cuts are really impacting on our communities.
Nurses should absolutely get involved with this campaign. They should be coming out to the rallies that are being planned. They should be showing up to the town hall meetings in the cities across Alberta that are going to be happening in the next month, and they should be voicing their concerns about these cuts to education and ultimately all of the public services.